Good afternoon, everyone. This is Woody Collins, and thank you for joining me in a talk about Congo. Uh, this is Thursday, so some places they call it Thirsty Thursday, but it is plain old Thursday here in central Indiana, and just thinking about our brothers and sisters in the Congo. And what I want to talk about today, we're going to be talking about mainly the sick. That's one of the principles of Congo Helping Hands. And so we'll be talking about sick people in terms of the Ebola virus and the Corona COVID virus. And my name is Woody Collins, and I'm with Congo Helping Hands. And we will get started and start talking about those. As I said, the sick. We have always helped the sick with mosquito nets, baby packs. When at one time in the Congo, the uh, the mortality rate for newborns were under 5 years old was 1 in 5, meaning to say that one child, only 4 children would live to be 5 years old in the Congo. So that's 1 out of 5. So that's 20% maternal mortality rate. So we started baby packs at that time, uh, uh, trying to get mothers to come in for their prenatal checks and doing things like that. Also getting mosquito nets because malaria takes up quite a bit of against the baby and also the pregnant mothers. So now we're talking about, in today's world, we're not talking about those things. Uh, Malaria is still out there and it's still killing babies and pregnant women. But the big thing we're talking about is Ebola. Ebola is one of those diseases that is extremely deadly to not only women and children, but to men as well. So it is really a killer, and it's more probably deadlier than COVID in terms of if you get Ebola, your death sentence is probably more likely to happen versus COVID. Especially if you're a younger person, you may not even see any of the symptoms, and you may not even know that you got uh, uh, the coronavirus. But for Ebola, if you get Ebola, you will definitely know that you got Ebola, and there's a good chance that you're going to die. So that's why we're concerned, and we're talking about these things every day, because it's something different from what Congo has traditionally been fighting. We have been traditionally fighting, and a lot of the other health not-for-profits have been fighting against. You know, they've been fighting to, and they've improved the mother and child mortality rates. They have decreased so that I think it's about 1 out of 8 now in the Congo. However, measles is still rampant, and cholera and things like that. However, when you're dealing with Ebola, there is really a lot more deadly, and also the coronavirus is so much more infective, infects a lot more people uh, than with the typical other diseases. So that's why we've been dwelling on it and we've been following it. But right now, up in Western Congo, which is relatively close to Kinshasa, it's relatively close, and it's also relatively easy to get to Kinshasa. For instance, it may be only 150 miles down the river, and the river is not controlled, and they don't have a lot of checkpoints on the river, of NOAA checkpoints that I've seen before. So therefore, you can go unabated down the river to Kinshasa and spread it to a large city that has 11 million people. So that's why we are worried about the Ebola. Also, as you see right now, most of the coronaviruses confirmed cases are in Kinshasa. And that's going to be an interesting time later this month as uh, interesting time this month, and interesting from the standpoint of something that we need to watch is that the airports and going to be open up, and also at that time people can freely travel out of Kinshasa. There's not a lot of intercity travel, meaning, say, most of the travel originates for airlines, originate in Kinshasa and fly out to different places in the different provinces and then fly back to Kinshasa. So there'll be a lot of people who will be leaving Kinshasa, going back home and out to their villages. That's probably is going to bring the coronavirus out to those places, even though that they're saying now that you have to have a a negative test within 72 hours of your planned flights. But as I was saying yesterday, that's going to be interesting because of the timeliness of testing that's going on, and don't even want to mention about the corruption and things, that how things slip through the cracks, or how people circumvent the system in the airports and also in Congo. For instance, you're supposed to have a yellow fever vaccination, and it's supposed to be registered on your international vaccination card. However, you can buy those in the airport for $35, and so you got proof that you have had a shot when in fact you just bought that while you were in the airport. So, I'm sure that there probably will be negative coronavirus test certificates available somewhere where people can make some money that they would not ordinarily come into. So it's going to be interesting, and interesting again from the standpoint of something that we're going to have to take note of and follow to see how it spreads or it don't spread. We hope that it don't spread. But as I said earlier, we have always, one of our principles is looking after the sick and attending to the sick, and that's in providing medicine. We even provide doctors training. We're also providing nurse training, and also have provided equipment and supplies into hospitals and health clinics. So it's something that we've always tracked and always been aware of, and we've done things in the past when it was just plain old measles and plain old malaria, plain old cholera, and just plain old child mortality. But now with this new emphasis, new uh, viruses that's coming about, now it's important that we continue to fight. And so we've turned our focus to helping the hospitals and the health clinics in fighting those different viruses. We just got notice yesterday that we had shipped up some equipment to the health zone, one of the remote health zones that I've been visiting in the past at Bulapay, and they're going to be getting mass wash basins for hygiene. As we talked about, hygiene and water is important, and soap is important to arrest some of these diseases. And so we provided the wash basins and buckets, and also we provided face masks. So, uh, so don't think that this is just because of what's going on in the world. It is just because it's going on in the world, but also we know that this is new to the Congo, and the Congo is going to be additive deaths in the Congo versus where here in the United States is something new and it's new deaths that we've never seen. And our death rate is not that high. But when you think about the Congo, their death rates from common diseases is much higher than ours. So finally, I'd like to ask you if you have any questions or comments, please leave them on the platform of your choice, either Facebook on Congo Helping Hands, on YouTube, or you can email me at wmcollins@congohelpinghands.org, and I will get those answered for you because we want you to be informed and to understand what's going on in the world outside of your state and my state and the United States. So at this time, I'd like for you to take care of yourself, be safe, and be blessed. And we will see you tomorrow for another talk at 3 o'clock about the talking about the Congo. Thank you very much for tuning in today, and we'll talk to you later.